Hi, I'm Dr. S.S. Honani. I'm surgical gastroenterologist. Today I'm going to speak about carcinoma colon or colon cancer. Colon we divide into three parts like means ascending colon, transverse colon, descending colon, sigmoid colon. Also rectum also comes under colon cancer only. But the treatment of carcinoma colon and rectal cancers are slightly different. What are the clinical features? Most common clinical feature is patient will usually present with passing blood in the motion, or sometimes they present with anemia, or sometimes vague abdominal pain or altered bowel habit. Some people will present with intestinal obstruction then if it is a very advanced stage. So most of the time all these clinical features are not very specific and vague. So anyone who is after 40-45 years of age, when they have altered bowel habit, or they are passing blood in the stools, or they are having unexplained weight loss, then we have to evaluate for the colon cancer. So how do you evaluate the colon cancer is, first thing is whenever you suspect the colon cancer, we see patient is in obstruction or not in obstruction. If patient is not in obstruction, we will plan for either colonoscopy or sigmoidoscopy. So whenever patient comes to a clinic with a history of passing blood in the stool, first thing we do is we do a proctoscopy, put a small camera inside the rectum and see, and we do a digital rectal examination. If it is a rectal cancer, very low rectal cancer, we will be able to feel it properly. In the OPD basis only we do the biopsy and send the biopsy. If patient is having altered bowel habit, vague abdominal symptoms, or blood positive, in that cases we suggest them to undergo colonoscopy. I prefer to do in IP setup. I'll admit in a daycare and give the bowel preparation. Once colon is completely cleared and patient start passing only clear water kind of motion, then we subject him to colonoscopy under anesthesia. So in the colonoscopy we will come to know where is the lesion, how much it is involved, whether it is in the descending colon or the ascending colon, and also patient have sometimes precancerous conditions like polyps. It can be identified in colonoscopy. Advantage of colonoscopy doing anesthesia is, if suppose patient has got these polyps, we can in the same setting we do a polypectomy, either using snare polypectomy or cautery, or sometimes if big polyps are there, we do something called submucosal endoscopic resection. All these things can be done in one setting. So that is the reason I prefer to do colonoscopy under anesthesia in our endoscopy suite. Once the diagnosis of carcinoma colon is done, we do a biopsy, confirm the biopsy, and we will do something called IHC also. So how do we plan the treatment for carcinoma colon? Depends on location of the tumor. If patient is having cancer in ascending, transverse, descending or sigmoid colon, straight treatment is surgery. If it is in the rectum, treatment is first chemoradiation followed by surgery. Before planning for the surgery, we look for a metastatic workup. So we do what is called PET scan. Once a PET scan is done, we will come to know where exactly the tumor, if a tumor has spread to some other areas. Sometimes tumor, if it had spread to areas like solitary metastasis will be there either in the liver or in the right lobe of the liver or left lobe of the liver, or solitary metastasis in the lung, then we can do a simultaneous resection of the metastasis along with the tumor. So treatment for colon cancer is straight away. If it is operable, we do a surgery. In our center, we usually do laparoscopic resection, whether it is a right colon or left colon. Based on the position, we do right hemicolectomy or left hemicolectomy or sigmoid colectomy. If a patient is having the carcinoma in the rectum, what we do is something we call neoadjuvant chemoradiation. So means we give chemotherapy, radiotherapy. Once after the 4 to 5 cycle, we reassess. Then patient will subject for either low anterior resection, ultra low anterior resection, or abdominal perineal resection based on where exactly the tumor, whether we can save the anal sphincter. So once the surgery is done, we then will finish the chemotherapy. In case of colon cancer, after surgery we give the chemotherapy. So now what we need to understand in the cancer treatment is, neither surgery, neither chemotherapy is not complete. Like we have to give surgery followed by chemotherapy. So comprehensive treatment is both surgery along with the chemotherapy, then only you will give better cure and better survival. So sometimes if a patient is not like in advanced stages, then most of the time it is a palliative. If patient has got obstruction and all, do a CT scan. If we are able to relieve the obstruction by endoscopically, what we do, endoscopic stenting we do, relieve the obstruction. Once a patient is stabilized, then we offer the surgery. Sometimes patient will be very sick, then in that cases we do diverting stoma. Once after doing the diverting stoma means we bypass and bring the colon to the skin, open the abdomen and bring the colon through the abdomen into the skin, and we'll open up, and more patient will be passing motion into the stoma. So these are all are initially tied over process where we want to save the patient with once stabilize the patient. Once patient is stabilized, then we plan for the surgery. So colon cancer is now it's very common. The reason is unhealthy diet, maybe fast food, preserved food, and less consumption of vegetables and more consumption of red meat. All these are leading to increased incidence of colon cancer. So how do we screen for colon cancer? So colon cancer, usually what we do is anybody after 50 years of age, we ask for one check colonoscopy as a baseline. Once the colonoscopy is done, then once in 6 months they have to undergo stool occult blood. If stool occult blood is positive, maybe we'll ask for a repeat colonoscopy. If a patient has got in a check colonoscopy polyp, we may ask for one more colonoscopy or 1 or 2 years after it. So usually check colonoscopy once in 5 years is enough, and every 6 months one should undergo like stool occult blood. This is how we screen for colon cancer. So healthy diet, maintaining good lifestyle, good body weight will help us to prevent colon cancer.